Welcome to Status Secure, the weekly cyber threat briefing for executives who refuse to operate in the blind. Hosted by the Watcher 6 Collective, uniting former Army Special Forces and Naval Special Warfare Communications operators, alongside an industry-leading CISO nominated for Cybersecurity Woman of the World. We cut through the noise and give you the operational intelligence you need for mission success in a hostile digital environment. The enemy is listening. Is your status secure? Welcome to Status Secure. Today we're covering identity attacks that are crippling organizations across every sector, the vendor and third-party breach pattern that is amplifying those attacks, and then we're going to get into everything you need to know about HIPAA. So, CISO, let's start with identity. What is the dominant attack vector right now in 2026, and why is it different from what we saw 2-3 years ago?
Well, in the past, bad actors just tried to get into your network, right? Like through network exploits, right? In unpatched systems, just knocking on the door, trying to find holes, right? Like that was their modus operandi, right? But now it's shifted, right? The dominant attack pattern, from an outside threat is now credentials, right? They're looking for stolen like usernames and passwords on the dark web, session tokens. They're trying to bypass MFA, right? Or they're hijacking the authorization, right? The authentication and authorization process. This has become a lot more lucrative for them, and in some aspects easier for them because people are human and make mistakes, give out passwords, click phishing links, and the reason this hits every industry is because every industry uses credentials, right, to log in. The bigger your organization, the more opportunities that actor has, right? So like in healthcare organizations, they issue credentials to thousands of clinical staff across hospitals, clinics, remote care, and especially as the workforce and the operating environment becomes more expanded into remote devices, right? And to remote environments like working remotely, or in the case of healthcare, when you go now, you don't stay in the hospital very long. They send you home and you have home care. So think about, all the devices and all the opportunities when your care is now in your home. So, GovCon, right, in the government contractor space, they issue credentials to subcontractors, to vendors and primes, right? In the tech startup, they issue credentials to engineers, and they're giving out access to everything. They have a small group of workforce, so everybody wears multiple hats, so they're going to get a lot of access, right? Financial institutions, they give credentials to wealth managers, compliance teams, all the SaaS integrations to all of their clients, right? Because everybody wants everybody wants to be able to see their data on demand. So now all your clients have access to financial data. The number of credentials in circulation inside the average enterprise has exploded. And now it's actually going to get worse because now you're giving credentials to AI agents, right? That's just, that is just exponentially increasing the available credentials that bad actors can look for, right? And can exploit. So in the last 30 days, the Mini Shai-Hulud variant comprised multiple enterprise environments through credential theft, right? So these are just examples of the threat landscape, right? That's just one. There's Zestix Initial Access Broker, right? They're selling stolen corporate credentials on the dark web. This has been going on for a long time, but now they're just able to sell more. And it's not a single industry. And think about it. It's so big that it became its own industry, selling stolen credentials, right? So why identity abuse is why we need to talk about it. So credential theft makes it sound like the threat is just stolen passwords. It's not. Okay? The modern attack chains include stolen sessions, hijacked OAuth tokens, deepfake voice-based social engineering against IT help desk, MFA fatigue attacks, and AI-assisted credentials harvesting at scale. identity abuse is the umbrella. Stolen credentials are just the most visible piece, right? So even though we just talked a lot about, user credentials, it's the whole ecosystem of access.
Yeah, and then there's the vendor breach pattern compounding on top of the identity attacks. So can you walk us through that? Because some of the biggest headline breaches of the last 90 days were not the breach organization's fault directly, right?
Yeah, so let's look at the Oncology Institute pattern, right? Earlier this year, the Oncology Institute disclosed a third-party data breach. The covered entity itself did nothing visibly wrong, right? Patients were still exposed because the failure occurred inside a software service vendor system. And we've known that third parties are, your supply chain is a concern. It is a huge concern. It continues to be. That's the quiet version of the loudest theme of 2026. The breached organization did the right things, and the breach happened anyway through a vendor relationship. Right? ShareFiles, Nextcloud, and OwnCloud clusters. Across the last quarter, 3 actors stole highly sensitive corporate data, including health records and government contracts, from multiple cloud collaboration platforms simultaneously. Aviation, defense, healthcare, utilities, mass transit, telecom, legal, real estate, government. All hit at once. The breach caused stolen credentials and lack of multi-factor authentication on the vendor side. Your security posture is now tied to the weakest vendor in your supply chain. Right? I mean, we've known that for a while, but it's so hard because this is your vendor. You can only do so much, right? You can try and verify that they have MFA, but you have to basically accept what they tell you, or accept. A lot of times they submit a SOC 2 or some other attestation, and you just have to accept that. That's the price of doing business these days. Why this compounds with identity attacks? Because identity abuse and vendor breaches are not two separate threats. They're the same threat operating at 2 layers. When you have one vendor compromise can expose dozens of downstream organizations. That's the thing, because now a lot of companies outsource, right? Outsource things, use third-party tools, right, on a SaaS platform versus having to have their own infrastructure and bringing it in-house, right? And so you are one customer in 50 or 100 other customers on that same platform, right? You're separated logically by security. So now, if that vendor gets breached, it's not just that vendor, it's their entire client, right? Their entire client list. And if you're one of those clients, unfortunately, that's you. Right?
Yeah. And so if I'm listening to this, regardless of what industry I'm in, what can I do this week to help close the gap on both identity attacks and vendor exposure?
And the first thing is make sure your MFA is on. Sometimes when you ask your staff, they'll tell you, yeah, we have MFA. And then, you do, but not on everything, right? Not on all. And sometimes administrators turn off MFA for administrative accounts because it's time consuming. Everybody should know better now, but sometimes they don't, right? And it only takes one incident, one case of not turning on MFA, and that's the one that the bad actors obtain, and then you're done. So, I know of a case where they actually got the credentials. I think we talked about in a previous episode where they got the credentials for Intune, and then they wiped all of, so make sure MFA is on for everything. Do a credential hygiene audit, right? Make sure you're auditing, that pull all the list of active accounts, right? And then make sure you're comparing that against HR. Do access reviews on a continuous basis, right? Make sure that you are doing least privileged, right? Making sure you have MFA. I mean, these are your credential hygiene. That's the basics of having accounts now. Right? Third is inventory your vendor and verify their credential management, right? Their account management. Make sure, don't just accept, sign the contract that says that they are going to provide security. Make sure you actually execute on your audit clause, audit them.
Yeah. And this is something we say often on this podcast is trust but verify. Right. And so going back to what we're talking about, here's why both of these threats land the hardest in healthcare, specifically. Identity attacks and vendor breaches together are the leading cause of HIPAA reported breaches. And so with that as a setup, let's get into HIPAA as we transition kind of into that for this episode. So why don't you give us the foundational walkthrough? Most healthcare executives have heard of HIPAA. They know about it. It's been referenced 1,000 times. Many of them have never heard maybe it explained from the ground up. Like, where does it come from and what does it actually require?
So HIPAA, which stands for Health Insurance Portability and Accountability Act, was passed in 1996. So just like the title says, portability, right? So this was to allow patients to keep coverage when they went from when they changed jobs, right? And they went from one insurance carrier to another, or they changed from one doctor to another, doctor, which anybody who provides care is called providers in healthcare. So, and payers are your insurance organizations, right? So that's the main purpose, was the portability. But when you are moving records around, you want to make sure that, people's privacy is still maintained, right? So that's the accountability part of the act. This was to make sure that when you're moving healthcare records, that it's, that the patient's privacy is protected and that there's security on those. And as the industry digitized, right, the patient records moved from paper charts into electronic systems. So HIPAA in its modern form is two main regulatory frameworks, right, that operate together. The privacy rule, which was finalized in 2003, and the security rule, which finalized in 2005. So you can see there were several years where it was basically, the HIPAA was very much just around, like, when you move health information, just make sure that it's that other people don't see it. Then with modern technology and records being digitized, they were like, hey, we need to make this stronger, right? We need to make sure that, as technology is being used more, that technology is also following the rules, right? Yeah, and then it gets confusing because each rule does different things, but most executives kind of put them together, right? The privacy part and the security part, but they need to really understand the difference between the two. And then, HIPAA applies to, and then, so now it's like, oh, who has to follow HIPAA, right? It's what is called covered entities in the rule, right? And there's three categories. You have your healthcare providers, like I mentioned, right? They provide services to patients, hospitals, clinics, individual doctor practices, dentists, pharmacists, right? Pharmacies, health plans. So health plans, these are your payers, the insurance companies, HMOs, employer-sponsored plans, right? And then you have healthcare clearinghouses, organizations that process health information between providers and payers. So remember United Healthcare? That had that huge, they're a healthcare clearinghouse. That's why that ransomware attack was so devastating and so impactful, because they process the health information between the providers and the plans. So if your organization transmits PHI, which is protected health information, electronically as part of, standard healthcare transactions, you are what's considered a covered entity. Okay. And HIPAA applies to you. And so another one is business associates. So if you're a covered entity, like who does business or who works for you or touches data for you, right? They're considered business associates. This is the category that most healthcare executives underestimate, and the one that lies directly to the vendor breach conversation, right? A business associate is any third party that handles PHI on behalf of a covered entity. So let's say, for instance, I'm a plan, right? I'm a plan. I provide health insurance, but I hire a company, right? I hire a company to just review, just to process my claims, right? So like when providers submit claims for care, for patients, my plan employees don't review it and move it to the next stage. I hire a third party to just review the claim, make sure that the claim is documented in the right way, and then they push it along the process, right? Well, that company is a business associate. You hire a company to provide you like an MSP to provide you like augmented staff to, just monitor the network. So they're not looking at PHI, but they're monitoring the network. That they're still considered a business associate. This is why like some executives think, no, they're not a business associate because they don't look at PHI directly. That's not true. Like if their credentials were breached, somebody could get access to PHI. So they're considered a business associate. Okay. And every single one of these, right, they have to sign what's called a BAA, a business associate agreement, which mandates that a business associate to follow HIPAA, right? And if they don't, then you actually, as the organization that has this agreement with them, because it's your responsibility to ensure that your business associates are following HIPAA. So what is HIPAA actually? So protected health information is any individually identifiable health information. And so, but when they say name, dates, medical records, social security numbers, photos, biometric identifiers, right? You have to remember that if I have just your name, is that PHI? No, it's not. So I have to have your name, and I have to have your medical record number, or I have to have, I have to be able to connect an individual patient with their medical information, and that becomes PHI. Okay. But that's why you still have to protect, your just the name field, because if they get the name from you, but they get, and they can connect that to another piece of data in your system, and then together they can identify medical history for someone, then you're liable, and you have to think about that, right? So you have to remember that. So there's, all kinds of things, but combined with information about a person's physical or mental health, right? So just because they have social security number, that's not PHI. You have to be able to combine it, okay, with something else. So the combination of identifiers plus health data is what makes information PHI.
Got it. Yeah, and I know as we're talking about this, some terms that are gonna, we're gonna go back and forth with privacy and security, and maybe sometimes, we might think of them as one of the same. And so for those of us who don't really understand the differences, could you kind of break down, especially in regards to HIPAA, can you break down the difference between the privacy rule and the security rule so that we can have a better understanding of what they are?
Sure. So the privacy rule, an easy way for me, a lot of times an easy way to remember is this. The privacy rule is around records management. The security rule is around technology management. Right? So the privacy rule governs who can access PHI. So when you talk about records management, it's what's a record, which is PHI, the owner, right? The data owner who owns the data custodians, right? Is, and so it's really around records management. So under what circumstances, for what purpose can people access the data? The data owner decides that, right? It establishes the patient's rights, the right to access their own records, the right to request corrections, the right to know who has accessed their information. So you can see this is all around the management of data, right? And the data owner, the real data owner is actually always the member, right? Or in the company, in the organization, it's usually you'll have a privacy officer, right? You have an executive that's accountable, right, for this. It defines the legitimate use of PHI, right? Like treatment, payment, healthcare operations. It restricts disclosures and requires patient authorization for most. So you can see these are business requirements, right? Okay, so the easiest way is to remember that privacy rule is around records management, data from a business perspective. The security rule, on the other hand, governs how PHI is technically protected when it exists in electronic form. And so when it's in electronic form, they add a little E in the front of PHI, electronic protected health information. It requires administrative, physical, and technical safeguards. It's the framework that most directly affected by the identity attack and vendor breach, because the security is what defines access controls, audit controls, transmission security, and the workforce security policies that determine whether a stolen credential or compromised vendor actually leads to a breach. So it says administrative, physical, and technical safeguards. Those can be mapped to controls. What's an administrative control, right? What's a physical control, and what's a technical control? You can map that, right? So administrative control could be something like, you have an access policy that, every user only gets one identity, one unique identity, right? Physical, This is really around protection of your data centers, right? Who can access the data center? Technical safeguards. This is, that, all PHI must be encrypted at rest and in transit. Okay? So, the privacy tells you what you must protect and who gets to see it. And the security rule tells you how you protect it once it's in your systems.
So now that we have a good understanding of that and a better understanding of HIPAA in general, can you talk to us about what HIPAA enforcement looks like in 2026? What would trigger an investigation, or what the consequences could be if something like that occurs?
Okay, so first, who's going to come after you, basically, right? And that's the Office of Civil Rights, OCR. And they're under CMS, which is, they cover Medicare, Medi-Cal, right there. But they're the ones that will come after you. They're under the Department of Justice, and what they'll do is they will investigate, send it to the Department of Justice, and then, you're off to fines and penalties. Okay, at that point. The breach notification rule, what this says is that you have to have it, the breach has to affect more than 500 people. At that point, you have to report it to OCR. You have, once you notify OCR, once you know that you have a breach, you have 60 days to notify the individuals who were affected, right? That's the breach notification rule. Civil penalties. So civil penalties, before I go through that, anything less than 500, because I don't want people to think that, if I have 499, I don't have to do anything. If you have 500, if it affects 500, then you have to just report it annually, right? And you get on a wall of shame, but you don't have to report right away. That's the difference. Okay. Civil penalty tiers. So on there, this is based on when they go and do the investigation, it's based on, what did you do with your duty of care, right? What controls did you have in place? How much did you try to protect your members, the PHI, right? And there's different tiers. I'm not going to go through them. You can look them up, but basically there's tier 1, you didn't know, and that's a minimum of $137 per violation, capped at $34,000. Tier 2 is reasonable cause, right? That means you knew and you didn't do anything. That gets higher, right? And then tier 3, willful neglect, means that you absolutely knew that something was going to happen, but you didn't do anything anyway, right? Tier 4 is, I take that back. Tier 3 is you knew and you tried to correct it, but it happened. Tier 4 is you knew, but you didn't do anything, and that's higher, right? So that's the penalties. And so it just gets worse and worse if you don't take care of it, basically.
And so kind of moving towards the end of this episode, if we like to give our marching orders. And so let's say we're giving marching orders right now to the healthcare leaders that are listening, as we've kind of gone over HIPAA. So we've covered some attacks, identity attacks and vendor breaches. We've covered HIPAA. What are 3 things they can execute this week to help close the gap so that they don't, fall victim to some of these things that we've discussed?
Yeah. So run the credential audit like we talked about earlier, right? Just do your audit and make sure you're doing, your due diligence there. Inventory your business associates, right? You probably have some that you've had for years. Make sure you're checking, every year you're actually updating your review of them, right? Making sure that you know what they're doing. Conduct a HIPAA security rule risk assessment. You should, you can do this every quarter if you structure it correctly, right? And it should be fast, especially if you're doing it on a regular basis. But those are the 3 things, because you have to remember that the biggest penalty with HIPAA is that you can end up with 10 years if there's an intent to sell, transfer, or use PHI. If there's no intent, it's up to 5 years in prison, right? And the minimum is, it's up to 1 year for a violation. And as an executive, I don't think you want to spend any time in prison.
Yeah, no, let's avoid prison, and let's avoid, people's information, PHI, getting out there for anyone to see, right? So 3 things: run the credential audit, inventory your business associates, and conduct a HIPAA security rule risk assessment. So identity attacks and vendor breaches are the dominant breach vectors across many of all the industries right now. So healthcare is no exception. And the operational truth is that a stolen credential or a compromised vendor walking into an unprepared healthcare environment is the breach that lands on the OCR portal. So
Mission success starts with closing the gap between the threat and the framework. Trust would verify your own posture. Run the audit, inventory your associates, your business associates, and update your risk assessment. Execute the standard, and we'll see you next week.
Mission success isn't about luck. It's about preparation. You've heard the intel. Now, go put it to use. If you need to verify your security posture, I've established a secure line at watcher6.com/secure. Go there to get the briefing the enemy doesn't want you to have. We'll see you next week. Until then, keep your head on a swivel.